Which type of shock is characterized by a low cardiac output and high systemic vascular resistance? Septic shock, cardiogenic shock, neurogenic shock, anaphylactic shock. Correct answer is option B, cardiogenic shock. Which disorder is characterized by excessive catecholamine secretion from the adrenal medulla? Addison's disease, pheochromocytoma, Cushing's syndrome, hyperthyroidism. Correct answer is option B, pheochromocytoma. What is the purpose of the Allen test before radial artery cannulation? To assess collateral circulation, to confirm the presence of a pulse, to measure blood pressure, to test capillary refill. Correct answer is option A, to assess collateral circulation. Which heart sound is associated with heart failure and fluid overload? S1, S2, S3, S4. Correct answer is option C, S3. Which assessment finding is most concerning in a patient with hypokalemia, fatigue, muscle cramps, decreased appetite, irregular heart rhythm? Correct answer is option D, irregular heart rhythm. What is the purpose of an incentive spirometer? Reduce pain after surgery, prevent atelectasis, diagnose respiratory infections, improve oxygen saturation. Correct answer is option B, prevent atelectasis. Which phase of wound healing is characterized by collagen production and wound contraction? Hemostasis, inflammatory phase, proliferative phase, maturation phase. Correct answer is option C, proliferative phase. What is a hallmark sign of a hemothorax? Decreased breath sounds on the affected site, hyperresonance on percussion, increased lung compliance, wheezing. Correct answer is option A, decreased breath sounds on the affected side. A patient with right-sided heart failure is most likely to exhibit which of the following symptoms? Pulmonary edema, crackles in the lungs, jugular vein distension, dyspnea. Correct answer is option C, jugular vein distension. The gold standard for diagnosing myocardial infarction is ECG, troponin test, chest X-ray, angiography. Correct answer is option B, troponin test. Which of the following is the priority action for a nurse when a patient is experiencing a seizure? Restrain the patient, insert an oral airway, turn the patient on their side, give oral diazepam. Correct answer is option C, turn the patient to the right side. Which electrolyte abnormality is seen in Addison's disease? Hypernatremia, hyperkalemia, hypocalcemia, hypomagnesemia. Correct answer is option B, hyperkalemia. Which position is commonly used for lumbar puncture in adults? Sitting, supine, prone, lateral decubitus. Correct answer is option D, lateral decubitus. Which ECG finding is characteristic of pericarditis? ST segment elevation in all leads, prolonged QT interval, peak T waves, white QRX complexes. Correct answer is option A, ST segment elevation in all leads. Which disorder is characterized by a defective chloride channel? Marfan syndrome, Huntington's disease, cystic fibrosis, phenylketonuria. Correct answer is option C, cystic fibrosis. What is the recommended position for a patient after a lumbar puncture? Trendelenburg position, supine position, high Fowler position, prone position. Correct answer is option B, supine position. What is the priority action for a patient with a suspected spinal cord injury? Immobilize the spine, assess breathing, give IV fluids, check reflexes. Correct answer is option A, immobilize the spine. What is the key symptom of compartment syndrome? Bruising at the site of injury, loss of pulse in the affected limb, numbness and tingling in extremities, none of the above. Correct answer is option B, loss of pulse in the affected limb. Which type of anemia is caused by vitamin B12 deficiency? Microcytic anemia, aplastic anemia, hemolytic anemia, pernicious anemia. Correct answer is option D, pernicious anemia. A glucose tolerance test is used for diagnosing hypertension, thyroid dysfunction, type 2 diabetes and gestational diabetes, kidney stones. Correct answer is option C, type 2 diabetes and gestational diabetes. Which finding is a key indicator of autonomic dysreflexia in a spinal cord injury patient? Hypotension, flushed skin above the level of injury, hypothermia, bradypnea. Correct answer is option B, flushed skin above the level of injury. Which immunoglobulin is most abundant in human serum? IgA, IgG, IgM, IgE. Correct answer is option B, IgG. What is the most important nursing action for a patient receiving nitroglycerin IV for chest pain? Monitor for hypertension, assess for headache, monitor blood pressure frequently, encourage deep breathing exercises. Correct answer is option C, monitor blood pressure frequently. Which diagnostic test is used to detect gallstones? Ultrasound, MRI, spirometry, ECG. Correct answer is option A, ultrasound. Thanks for watching. Subscribe to the channel for the latest informative MCQs.